situation, testing people's blood and urine and whatnot, and not having the qualifications, and when students come in, that person is doing the training. Now, that position was even non-applicable for the bilingual policy that you're saying. But that is happening in the hospital today, and that's dangerous. So we're very careful in knowing, find out the information before we sit here and discuss issues. I care for our health care. That's what we're here. This is a healthcare situation, not just an employee situation in terms of hiring practices. So I think there's ways of moving around this issue. You're making it like it's not. I think there is. There's different ways we can look at this, and we can give you different suggestions. I think the advanced level of qualifications applying to do the test is too advanced. So many people coming from all over the area that went to school 50-50 immersion, and you're a principal of 50-50 immersion, right?
That's correct.
How many children from your teaching that you've taught in your school would ever have an opportunity to work at the hospital with the advanced testing that's there? How many?
I have met a number of my students, so I'm glad you mentioned that. I'm really proud to say that they have done a great job in going ahead and finding employment.
Not at Cornwall Community Hospital.
Oh, I did say that. I meet them, and they're always very proud to remind me that it was a long time ago, and I dare to tell them that, well, maybe not so long ago, but they are there, and they are doing a good job. And as far as individual cases, I would ask you to consider the fact that when someone is going to an interview and the results are not in their favor, they may see the obvious, but there are definitely some things they may not be aware of. So I would say that you can be assured that we have worked very hard to receive funding for our hospital in many ways, and we don't spend it foolishly. So we do spend it and get the most qualified person that we can for the job. That's our commitment. And so
I just want to ask a question. Are you following Section 7 of the Act, where it states the obligations of government agencies and institutions of the legislature during this act are subject to such limits as circumstances made reasonable and necessary, of all reasonable measures and plans for compliance with this act have been taken or made. So what it's saying is make reasonable efforts in terms of the catchment area that's bilingual in our area. Is that correct?
that's correct, and that's what we're applying. We're being reasonable in our ability to provide that. As I mentioned earlier, there are certain factors that come into play that we have no control of. When someone is out sick, we do our best to have our ratio of French-speaking staff who are available, but if someone is out sick, they are out sick. So we are reasonable in what we do. Certainly our focus remains on qualifications, skills and experience, and French is one skill that is applied in this area. And as I say, it's one that we give credit to when we need to.
Any other questions? So, I don't think this problem's going to go away until we understand what the changes are going to be made. So where do we go from here? Council will reflect and review the discussion held here tonight, but on a go-forward basis. The Township is respectfully requesting that the Cornwall Community Hospital give serious consideration to equitable and fair hiring practices, including opportunities for advancement and promotions, specifically to your part-time employees. We anticipate further communication and confirmation from the Cornwall Community Hospital regarding equitable hiring practices and policies. Public service organizations need to be accountable and transparent as well. Everyone is affected by decisions we make in our communities. Thank you.
Thank you. In closing, I would just like to say thank you for this opportunity to present to you today and for your continued support for quality health care. As you had mentioned in your motion, you were looking for reassurance that we don't hire by language only, but that we hire by qualifications and experiences and skills. And tonight we've given you that reassurance, or at least we hope we have.